Hi, I'm Dr. Eti Ben-Shabbat from Brain Rehab Academy, and in this video I'd like to speak with you about the relative contribution of brain imaging and clinical assessment. A few clinicians have asked me about this, and I think the reason they ask me about this is because they've got some reservations with regards to brain imaging. And I think they're likely to have one of three reservations. The first reservation is if someone looks carefully at brain imaging, they may not be interested in conducting a thorough clinical assessment. The second reservation might be around if someone looks so deeply into brain imaging, they may not be interested in getting to know the patient. And the third one is around if someone is looking at the brain imaging and paying a lot of attention to lesion volume, they might exclude someone or not give someone a chance for rehab when in fact everybody should be getting a chance for rehab. So let me address those three reservations with regards to brain imaging. I want to start off by saying that brain imaging and clinical assessment are not mutually exclusive. They supplement each other, and therefore good clinicians would conduct a thorough assessment of the brain imaging as well as thorough clinical assessment. The first point about brain imaging and not paying enough attention to the clinical assessment or enough depth in the clinical assessment is a myth I would like to bust, because when you look at brain imaging, it helps you focus your attention to what the problems really are or likely to be, and therefore you can dive deeper in your assessment. And let me give you an example. If I'm a speech pathologist and I've got someone with aphasia and I'm trying to sort out whether it's a global aphasia, is it a receptive aphasia, or is it an expressive aphasia? If I look at the brain imaging and I see the exact location of the lesion, then I can start having a general idea of whether I'm dealing with expressive, receptive, or both. And accordingly, I could dive deeper in the assessment and I could determine whether this will be an issue or not and what part of the aphasia I need to address. The second point is about getting to know your patient. I'm going to start with an example here. I remember consulting on a case, and it was a case of a lady who had memory issues. And they weren't sure whether the memory issues were related to neurodegeneration or something else that was going on. And I said, let's have a look at the brain imaging. That's going to help us start finding out what the origin of the problem is. So we looked at the brain imaging, and it was evident that perhaps the memory problems are actually due to neurodegeneration, because you see certain changes, atrophic changes in the brain that could suggest, for example, Alzheimer's rather than just general memory problems. In contrast to a different case that I consulted on, where there was a young girl that had memory issues, and the dad felt it was a result of chemotherapy and radiotherapy, whilst the clinicians thought that maybe it was there from before. Looking at the brain images helped clarify that this is likely to have been a cause of the treatment rather than premorbid issues. So you can see that by looking at the brain images, it can help you ask the right questions. You can ask questions about how this person was premorbidly, because you already have a certain idea of what might be the case. So you use that extra level of questioning to direct that information would either confirm or dispute your theory. The last point is about lesion volume. And I agree that historically there was a lot of attention that was paid to lesion volume, suggesting that larger lesion volume is associated with poor prognosis. The thing is that I've seen a lot of clients that made really good recovery even though they had large volume. Because it's not just about the volume of the lesion, it's also about which specific areas were affected. So looking at the brain imaging can really focus your attention on the anatomy, which structures are affected, and therefore how does it affect function, and therefore what's the potential for recovery. So in summary, brain imaging and clinical assessment are not mutually exclusive, and they can help each other a lot and help you as a clinician to get to the bottom of the problem and be more precise with your assessment and more targeted with your treatment. I hope this helps you, and if it does, please like and share it with your colleagues. I look forward to seeing you next time.